So here's some basic things that you can do, particularly for visual motion sensitivity and also for light sensitivity, because the person who asked this question was most concerned with, crowds and motion, and also with light sensitivity. So I figured we would answer those. If people are interested in this, or you have other concepts that you're interested in, just send us a message and we can put it into kind of the schedule of potential upcoming podcast topics. I don't want to get into like a full vision lecture here. It's not even my expertise, but I know some basics. So visual motion sensitivity, the big thing with concussion right now is exposure therapy. So it's called habituation and adaptation. If you have an issue that creates an increase in symptoms for you, the idea then is to challenge that system until you're able to go through normal life without having those symptoms. So the way that I explain this to people is consider it to be getting yourself in shape. When I first, and God, I hate leg day, but when I do legs, okay, the first time I do legs, if it's been a while, I'm like, all right, I need to do some legs. I'll go in and I'll squat and I'll leave the gym like a zombie with my legs straight, like a Frankenstein with my legs straight and sore and painful, and I won't be able to walk right for 3 full days. Then the next week I come back and I do it again, and all of a sudden I'm less sore. It doesn't bother me as much. And then the third week I do it and I'm like, oh yeah, I'm sore. Okay, now I need to up my weight. I need to challenge myself more because I'm not, it's not as challenging for me anymore. And then you continue to do that. And so this is the same thing. Right? If something makes you feel dizzy, makes you feel off, and let's say it's visual motion sensitivity or large crowds, what you should be doing is putting yourself in scenarios where you're in a large crowd. At first, you might only be able to tolerate for 5 minutes. That's okay. Just make sure you have an exit plan. I go into the mall, I walk around, okay, I'm feeling weird, okay, I need to leave. You go back out to the parking lot, you sit in your car, you let things calm down. Once you're feeling better, you go back in. Okay, now I can get to maybe 10 minutes. And you keep doing that until you're able to tolerate it. So it's the same scenario. When you first do it, it's going to feel overwhelming. But if you react by pulling back, similar to me, if I say, oh, when I do legs, my legs get sore, I'm not going to do legs anymore. Do you think my legs are going to get stronger? No. And it's the same concept. If I'm going to pull back and say, well, when I go in crowds, I get dizzy and I feel off and I don't like that, so I'm going to respond by not doing it anymore. Well, you can't live your life like that. There's crowds everywhere, and that's not how you want to live your life. And so unfortunately, you got to put in a little bit of hard work and put yourself in scenarios that make you feel uncomfortable. Like any growth mindset, you have to do things that make you feel uncomfortable. And this is no different. So exposure therapy, habituation, adaptation. If crowds make you dizzy, throw yourself into crowds. Do it incrementally, and do it and just keep gradually increasing it so that when it's not bothering you as much anymore. The next thing is binasal occlusion. This is more of a Band-Aid than an actual treatment solution. But what binasal occlusion is you take a pair of glasses. We just decided this topic this morning, so I don't have any props with me. I didn't bring my binasal occlusion glasses from my clinic. But basically what they are is if you take glasses and pop the lenses out of them, or even keep the lenses in, but then you put tape on the inner part that covers kind of the middle, 1/5 or maybe 1/4 of the lens on the inside. That actually helps with people that have this visual motion sensitivity. And the theory on that is the way that you know what we need to do? Sorry, I'm getting off here. I'm talking to Sam. You know what we need to do is we need to do that like a whiteboard drawing, and I'll explain visual and peripheral and visual motion sensitivity with binasal occlusion and how that works.
Perfect.
Okay. Coming soon. Stay tuned. But anyway, quickly verbally to explain it, because I know that people are listening and they can't really get it. Basically, the way your eyeballs are set up is that everything is crossed through your retina. So things that are on the left side of your vision are actually being seen by the right aspect of each of your eyeballs. And same thing, anything on your right field of vision is actually seen by the left side of both of your eyeballs. So there's this crossover effect. It's just the way that light comes through and hits our retina. Binasal occlusion, what it does is it cuts off that one of those signals. So if something's off to my right and my left eye is blocked here from being able to see it, I now only get one copy of that light information hitting my eye versus having two copies if I'm getting a copy from each eye. So that just reduces the stimulation, and people often will feel a lot better in a crowded environment when they have a binasal occlusion situation going on. I'll draw the picture, we'll do the whole explanation, and we'll do it in a separate video. And of course, visual motion sensitivity. Also, I would want to rule out vestibular and neck issues because oftentimes that is there as well. The other thing that can play a big factor in this is anxiety. So if you feel that going into a crowded environment or, being at a concert or something is going to make you feel bad, well, even before you go, the anxiety of what might happen starts to build, and then all of a sudden it becomes chaotic, right? So even things like that, as the anxiety of the situation before you put yourself into it, can impact how you're actually going to respond to that challenge. So keep that in mind. Know that it's possible. Next up, light sensitivity. Again, there's a few theories on why this is, but one of the things you should not be doing, which I see all the time, is people just staying in a dark room. That used to be the old school mentality of it. Let's just stay in darkness. But what that does is it actually creates light sensitivity. If you've ever been to a matinee movie, or if you've been downstairs watching TV on a Saturday afternoon, and then you come upstairs to where it's brighter, all of a sudden you're like, oh my God. Right? It feels like somebody has thrown sand in your eyes. But it's just because you've been in darkness. So the way that your eyes do is your eyes will adjust to darkness. Right? You ever notice that when you dim all the lights down, things seem really dark at first, and all of a sudden you get used to it, and you can see everything really clearly? That's kind of your night vision kicking in. If you were to flick on those lights right away, all of a sudden, boom, that's intense for everyone, concussion or not. So staying in darkness, and you come out into a light environment, people start to believe that they still have light sensitivity, but it's actually just the fact that they've been sitting in darkness for 3 weeks, and now they're exposing themselves to light. The other thing, don't wear sunglasses indoors. Okay, if you're outside and it's a sunny day, of course, wear your sunglasses. That's eye protection. But inside, you do not need to wear your sunglasses. Get used to the ambient light that's there. Sometimes it might be just one of the wavelengths of light. Sometimes blue light can bother people. Sometimes it's other wavelengths of light. So you might need glasses with a special tint in it to try and filter out some of that, some of those, that UV spectrum of light, but you don't want to have just straight blocking of light, because that will just create light sensitivity. And actually there's been studies done on this that have found that people that wear sunglasses after their concussion are way more likely to end up with photosensitivity, light sensitivity after a year following their concussion. So try to avoid it as best as you can. And again, it's almost like exposure, right? Get used to regular light. Look for certain filters, because certain light might be more impactful than others. Also, there's blue light filters on your phone, so you can actually change your phone. I know that when I hit a certain time of day, my phone has a blue light filter coming on, so all blue light is filtered off my phone because that's helpful for sleep and the production of melatonin. Also on your computer screen, I think you can do this with some newer models of computer. You can shut that blue light down. There's also things you can do like little blinds that go on a computer screen. There's technology you can get. Iris Technologies is one that comes to mind, but it's basically an e-paper screen, so it doesn't have that LED backlight. And these are all just band-aid solutions, right? We don't really know what a treatment for light sensitivity is. We know how to have these little things that can help us feel more comfortable with it, but don't go into the darkness and don't wear just sunglasses, because that's not a solution. That actually perpetuates and makes the problem worse. So next thing, last piece of advice on light sensitivity is just move on with your life. Okay, I find that a lot of people with light sensitivity, they will look to light, like there's lights in here, there's a huge light right there, right? And to see if people are light sensitive, oftentimes they'll look right at the light. Like I'll have a patient in my office, and we have these UV lights over top of our clinic too. It's this big kind of training facility. And I'll ask a patient, oh, are you light sensitivity? And then before they answer the question, they'll look directly at the light and be like, yeah, oh yeah, that's bright. Nobody looks directly at the light, okay? So just try to go on, live your life, and don't be looking for symptoms. If you're constantly looking for symptoms, you can continue to find them, right? If I believe that I'm light sensitive and to test myself I keep looking at lights and they look bright to me, I'm going to think that I'm light sensitive. Meanwhile, I'm not light sensitive. It's just the fact that we're not meant to look directly at the light. Don't look directly at the sun. Don't look directly at the light, and just try to move on with your life and not let it, hinder you at least as much as you're able to. You can find solutions that are helpful, but just avoid wearing sunglasses and going into darkness, and try to put yourself into kind of exposure environments, obviously, that are still safe for your eyes. Don't be going outside in like really bright days and not wearing sunglasses. I'm just saying inside, try to get used to regular ambient light.